Hello, everyone. Welcome to this special presentation in the HSVMA webinar series. Thank you for joining us tonight. I'm Lorna Grandy, and I'm a veterinary advisor with HSVMA, and I help to produce this continuing education webinar series, and I'll be your moderator tonight. HSVMA is pleased to welcome Dr. Hillary Jones as our speaker this evening, but before we get started, we want to go over some technical information. For our regulars, you may notice that we've changed our webinar platform. So your toolbar is now at the bottom of your screen. And if you just hover your cursor over there, it will appear. All attendees are muted so that we don't have to listen to each other's dogs and cats. If we do have technical difficulties tonight, we hope that you will be patient with us and we'll try to resolve them as quickly as possible. If you do have trouble with the reception on this broadcast, remember that it is being recorded and it will be archived so that you can listen to it later. So we just want to take a minute during these unprecedented times to thank those of you who are essential workers. Many of you are out there working on the front lines, not only veterinary professionals, but shelter staff, animal control officers, and others. And we want to thank all of you and hope that you are safe. This is also a link that we have to our, hang on, there we go. This is a link to our HSVMA COVID-19 resource page. And we think you will find this page really interesting because it has some links on it that some other pages, veterinary pages you may get don't have. There's some interesting things like a white paper about the connection between wildlife wet markets and COVID, information about emergency contraception in a time when we are not doing spay-neuters, and also a toolkit that links to grants to help people and pets stay together during this difficult time, so that we hope that you will find some of these resources useful. So please, most of you out there actually are members of HSVMA, but some of you are not. So let me tell you a little bit about HSVMA. The Humane Society Veterinary Medical Association is a national professional association for veterinarians and veterinary technicians founded in 2008. Our focus is on animal health and welfare. These photos are from just a few of our programs. HSVMA provides a forum for veterinary professionals to advocate, educate, and serve. During 2019, more than 1,000 veterinary professionals joined HSVMA in actively advocating for advancements in animal welfare on a variety of federal and state legislative initiatives. These initiatives range from things from extreme confinement of farm animals to puppy mills, horse soring, and veterinary reporting of animal abuse. We also have a state representative program where we have 30 states where veterinarians represent us in different outreach efforts. And HSVMA partners with various Humane Society United States programs to offer field service opportunities for veterinarians and technicians. So please contact us if you are interested in any of those programs. So we're going to be sending you a follow-up email 24 hours after this webinar, and that will include a PDF of the program that Dr. Jones is presenting tonight, as well as an ebook that she will be talking about. So watch for that in 24 hours. If you have questions during this webinar, please type them into the questions section on the taskbar at the bottom of your screen, and we'll get to as many of them as we can at the end of the presentation. So please let me tell you a little bit about tonight's speaker. Dr. Hillary Jones graduated from Tufts Cummings School of Veterinary Medicine, my alma mater, and completed a small animal rotating internship at Fifth Avenue Veterinary Specialists, now Blue Pearl downtown. During her time as a primary care and emergency clinician in New York City, she was inspired to look for a better way to connect with her clients and her pets, leading to the development of Teletails. Since its launch, Hillary has been working daily with veterinary teams across the country and thought leaders, such as the AVMA and AAVSB and state associations, to help veterinary medicine safely evolve digitally. She speaks on the benefits, opportunities, and economics of implementing telemedicine in veterinary practice. So please take it away, Dr. Jones.
Hi, thank you so much. I also want to check and make sure that switch worked nicely. I hope everybody can see my screen. And
your slides, yep.
Wonderful. And I'm excited. Thank you so much for having me on tonight. I'm really looking forward to chatting with everybody. I'm sure we all wish that we didn't necessarily have to talk about coronavirus, but I think it's a good opportunity to talk about some of the ways technology can help us in the future. So what we're going to do is we're kind of going to jump in the goals for this evening, just to kind of get a little bit of an idea about the different types of telemedicine and the roles of the VCPR. I think we're all hearing a lot about that in the news. Sort of discuss video-based telemedicine platforms and the ways that these can help us be more efficient, get some additional revenue, and also extend care to a population that may have a little bit more difficulty accessing veterinary care. And then lastly, we'll talk about coronavirus, how it's changing our client behavior, and how we can try and help mitigate some of these effects. So to begin, telehealth is this big umbrella term that's pretty much used for all types of this digital communication. We generally think of telehealth as that general guidance that you offer outside of an existing VCPR. So I think a lot of us will be very familiar with that as the, when a new client calls and asks a question and you give general advice, or what your licensed technicians and nurses are able to do. There are exceptions, right, for emergency triage and poison control, but generally this is telehealth is this outside VCPR, and a lot of what we're going to be talking about tonight is telemedicine, which exists within that VCPR. So most states require a VCPR for a veterinarian to diagnose, prescribe, or treat, and most of the states state that to establish a VCPR, you need a hands-on physical exam. Now, this is my first caveat of the evening. I am not a lawyer. This is not legal advice. This is information I have gathered from state board associations and the AAVSB. So this is sort of a summary of what they have available. As always, I recommend going to the primary source if you have questions, which would be your state association. But as of end of the week last week, as it's stated in Veterinary State Practice Acts, these states have specific requirements, and then others just talk about VCPRs for prescribing medications. Secondly, we have a second set of rules to think about, and those are federal rules when it comes to prescribing extra label drugs or issuing veterinary feed directives. And again, that federal VCPR requires that in-person exam. What I think we all have heard about is during coronavirus, there's been a lot of change. So the FDA has sort of loosened the extra label and veterinary feed directives, the VCPR that comes with that. But where things get extra interesting is that the federal rules, right, the FDA has made changes, but that doesn't necessarily supersede state changes. Some states have made very clear statements, about their State Practice Act, allowing you to practice outside that VCPR during this sort of more emergency situation. Interestingly, some states, for example, California, has moved a little bit the other way and wants it very much to be not only the VCPR established, but for that specific, issue that you're seeing that patient for. But again, this is not legal advice. This is what I've gathered from the AAVSB. So when you're thinking about digital care, sort of being very cognizant that these things are changing quickly, especially during this time. Always check in with your state organization. If you're in one of these states, your life just got a whole lot easier. If you're in one of the states that hasn't said anything, it's a great time to reach out to your organization, the AAVSB, or other regulatory organizations. Now, we're going to get even in a little deeper. So the DA has also made some changes to make life easier in this emergency situation, but have set out some very specific conditions to be able to prescribe controlled substances outside of that hands-on physical exam, right? And the one I'm going to draw your attention to right here is this telemedicine communication using an audiovisual real-time two-way interactive communication system. So this would be, you know, any video-based telemedicine platform, right? So having that back and forth interaction. And again, as always, they end that off nicely with, you know, in accordance with applicable federal and state laws. So again, if your state has made some of those changes, you're in the clear. If your state hasn't, I would definitely check in with them about when it comes to prescribing controlled substances for those outside VCPR relationships. So again, as I mentioned, these are some great resources that I use to try and keep up to date with the changes and what's happening. And so these are great primary sources to check out when it comes to questions about what's happening in your state. When I started looking and writing this, this webinar, you know, there were a few states, and by the time I was done, I had to go back and update as things are generally changing that quickly. So again, please, you know, look directly to your organizations to give you the most current up-to-date information. So now that I've probably made life a little bit grayer for everybody, I thought this could be a good time to sort of get an idea from our audience of, you know, what are people doing? Are people currently doing any telemedicine at the moment? Great, so if you wouldn't mind, everybody please voting in the poll so we can get a little bit of an idea of, you know, where people are and what you're doing. You know, are you doing telemedicine? Are you not doing telemedicine? I know sometimes starting with the legal stuff can sometimes seem a little intimidating, but I wanna make sure we have everybody on the same page as we move forward. So we'll just take a little bit more time, make sure everybody has a chance to vote so we can get some answers and see what comes up. All right, great. What a nice split we've got going on here. So 40% of you say yes, you're doing telemedicine. 53% of you say no. But to be honest, I'm not sure I agree with that 53% of you, because I can bet that you are answering client questions over the phone, you're answering emails, you're having people send you pictures that you're looking at and interpreting. And when we think back to the very first slide, as we sort of talked about telehealth as that big overarching umbrella, I bet we're doing a little bit more of it than we think. We just need to, if you know, we can turn it and use a platform, we're going to actually make it easier for us to work. We're already doing the work, let's make it easier. Excellent. So we're kind of going to jump right in now to, as I mentioned, let's use a platform to make our lives easier. So the first thing we're going to chat about is how telemedicine can save us some time. So I apologize for this being a small animal general practitioner focused day. That is where I come from, so it's sort of where my brain immediately goes. But you know, when we think about our day, sort of where does our time go? We have all of our exams, and we have, you know, that can be anywhere from 15 minutes, in some cases up to an hour. And there's the time it takes to check in and to check out. You have your emergencies and your walk-ins. And if you're an ambulatory or a mobile practitioner, you have your travel time. You have all those questions you get from your clients, your callbacks, your messages, you're writing up your records, you know, charting your client communications and your PEs and all of your plans. So this is, you know, when you look at your day, I figured out I was spending about 3 hours a day on the phone, and so giving away about 750 hours of free advice a year. And so sort of when you look at this day, it may seem long, but when you look at all the ways it gets chopped up, I think the one thing every vet in any kind of practice needs is more time, right? So digital consultations can help you save that time. First, we can eliminate some of that check-in, check-out bottleneck. According to a survey done by the AVMA a year or so ago, it talked about how a client on average waits about 19 minutes at check-in and 10 minutes on check-out. So that's almost a full exam time worth that they are spending waiting. And so the longer clients wait, the decreased customer experience they're having. There've been a couple of studies that say, longer wait times are sort of one of the big factors that make clients less likely to return. So if you can eliminate that bottleneck, you make a better experience for your client. You're also going to make a better experience for the rest of your clients there at your practice, because if you have fewer people trying to utilize that front desk, it's going to be more efficient for the people who are in your practice. It's also going to save you some time because you don't need to load the room, get it ready, clean the room, all of the steps that happen in between each exam when done in office. So as I mentioned before, I was spending about 3 hours every day on the phone, in the current system, I think a lot of us, we're spending, these 25-minute phone calls or taking time to respond to an email, making sure the tone sounds right. So a video consultation on average are 7 minutes long. So it's a much shorter duration. This is mainly because you don't necessarily need as much history from your client. You don't need a 15-minute description of what's happening. You can see and you can ask appropriate questions and kind of guide that conversation much more efficiently and earlier in that conversation. It takes about 4 times longer if you were to do that messaging based. So say you had a client who sends you a message first thing in the morning, you might respond in an hour with an additional question, then they have to get back to you. So it could be all day before that problem is solved, which is fine if you want to kind of do it as needed. But if you do a video consultation, you can kind of get the whole thing wrapped up in a much shorter amount of time. So, my appointments were on average about 30 minutes. So I could see 3 video consultations in the time it would take me to see 1 in-office exam. Shorter doesn't necessarily mean better all the time, right? I think that's something some people are concerned about, but actually in this case, we're finding that there's a really high success in client satisfaction rate with digital consultations. In 2018, there was a paper published in JAVMA that talked about owner-reported satisfaction. And so it said, owner-reported satisfaction with recheck exams did not differ substantially between the telemedicine group and the controlled group. In addition, responses from owners of dogs in the telemedicine group indicated a strong preference for the use of video conferencing for similar appointments in the future, and indicated they thought their dogs were more comfortable during the video conference appointment than what was typical for their dogs during an in-clinic recheck exam. So, we have clients that are enjoying the convenience and the high quality care that they're getting from a digital consultation. I think one of the other reasons is they can get some really great actionable information. Over the phone, sometimes quite rightly, a lot of us are very conservative because we have to think, what's the worst case and what do I need to do to rule that out? So one example that I always like to bring up is sort of somebody calls and says, my 8-year-old golden, it can't get up. So is this, you have a little bit of arthritis, maybe a little heavier dog and some slippery wood floors? Is this, you have an 8-year-old golden, is this a hemangio and we need to, deal with this ASAP? Is this something neuro, right? And over the phone, you would immediately say, okay, I need to see you. If you can do a digital consultation, you have the opportunity to be like, oh, I see a happy-go-lucky kind of fat golden slip sliding around on floors. I now know, we can talk about mobility and weight loss and management versus, okay, I'm sending you to an ER right away, or yes, you need to come in. So it gives people, more of an ability to gauge how you need to direct them. I'll give you 2 other examples here about how, because it's easier to schedule a digital consultation and it's easier for your clients to do a digital consultation, they're more likely to do your follow-up. I don't know if you guys had the same issue, but a lot of times, right, you get your treatment plan and then you want to do a recheck. If clients think things are going well, it's unlikely they're going to follow up with that recheck. But what you think is going well and what they think are going well might be a little different. So being able to use digital consultations for your rechecks can really improve your client compliance, which then can ultimately helps your patients and may save yourself future visits in the future because you are really solving the problem completely rather than almost. So the first case I like to talk about is Sierra. She was a 4-year-old female spayed Rhodesian who had a low-grade mast cell tumor that was surgically removed. Not long after surgery, her incision was a little red and swollen. The owner was really worried, but she didn't have a car, and taking her big dog on public transportation was really difficult. So she was really worried about not being able to get back into the practice. Did a digital consultation. The vet was able to order and deliver antibiotics to her, teach her about warm compressing, and they didn't need to do a recheck, but was able to sort of deal with everything. They did a second digital recheck exam. Everything looked great. And so the problem was solved without needing to necessarily come back in. And again, all of these appointments were, 8 minutes long. The example you'll see here on the phone this is Milk. So Milk is a 3-year-old female spayed bulldog who has a history of skin and ears and all of those great bulldog things. So this isn't the first time this had happened to Milk. And so the owner was kind of thinking maybe she might be able to manage this at home. But then was like, oh, because I don't need to go in, maybe I'll try this new system my vet has. And so she started a consultation and sent in these pictures. The CSR team was able to guide the owner that consultation seemed appropriate. The vet was able to do a video call, get some meds on board, and make sure that Milk got the care that she needed so that this didn't progress, continue to get more uncomfortable, and potentially get harder to treat. So obviously these saved a huge amount of time for the owners as for the vets as well. I think one of the biggest places where when it especially comes to time saving is in mobile and ambulatory practice. When I, a couple years ago, was doing sort of a survey with some mobile and ambulatory practitioners in the Northeast and asking, how much time they were spending traveling, what their average travel time to and from their different site visits was, and that's how I got this sort of 35 to 75 minutes, right? So if you can do a video call with that client before you decide you need to go there, and it turns out you don't need to go, you've saved yourself, almost 2 hours, of travel time. Or if you do assess and say, yep, I do need to go out there, it gives you the opportunity to offer some guidance until you can get there. Maybe there's something that they can get started on or things that they can get ready for you so that when you do show up, again, you're able to kind of jump right in and get started. One of the other things that has come up a lot when I speak with mobile practitioners, house call vets, any sort of ambulatory, is that sometimes the follow-up, it's really hard to either financially make it worth it for the clients to pay for you to come back out, or just based on the time, it's sometimes really hard to do all of the follow-up that ideally you'd like to do. So if you can institute a video-based telemedicine platform, it gives you the opportunity to do those follow-ups digitally, save yourself the travel time, improve the compliance for your clients, just like in the small animal practice, and perhaps save yourself a future trip because you were able to deal with an issue earlier and get it solved rather than waiting until it turned into something a little bit more serious. One of the other places that this can be a huge time saver, is in sort of that shelter and foster setting. I know for me, when I was in college illegally fostering dogs in my college apartments, it was, if I had an issue with my fosters, it was heading back to the shelter or to one of a specific veterinarian that was sort of partnered with them. Neither of those places were particularly near where I was. So for me, the idea that I could talk to the vet that the shelter organization I already knew, from my dorm room is unbelievably convenient for me. It's also going to help maximize some limited resources for the shelter or the rescue organization. Right? If you can have people centralized talking to your staff, your volunteers, your medical team, you're not going to have to pay partner hospitals. You're going to be able to keep a closer eye on all of your fosters and all of their different places, and sort of leverage your team to help all of your foster families. One of the other things that can be really helpful there too is you get the opportunity to see them, in a home environment. So what's their behavior like at home? That's not them when they're there in the shelter. How are things like, getting used to crate training, or, living with, small children, or any of the things that, sometimes a lot of the questions that we ask, how pets are doing, being able to see them and check in with them in that home setting using a centralized telemedicine platform can be amazingly helpful. So great. All of these great ways that it can really help save you time, get you some better information, but you're not going to be able to solve every problem and diagnose everything based on telemedicine alone. Sometimes patients will definitely still need to come in. This is not a failure. It was still an opportunity to educate, to chat with your clients. They now know why they're coming in and what the concern is. And for your doctors and for the rest of your staff, you kind of immediately know where to jump in. You know where you're directing your attention. You know the next steps you need to take. And you don't need to spend time explaining or convincing why, because you already had that great conversation previously. In some cases, it may be that there are specific diagnostics or injectables or different therapies that need to happen. And maybe the veterinarian doesn't need to be the one that sees them for that. If you have the opportunity to have nurse appointments or tech appointments, you can have them come in, have what needs to happen, and then, return them to their family, have another digital consultation to review results and sort of evaluate progress. In a coronavirus world, this is also really appealing to sort of help with that social distancing, right? We don't need to all be in an exam room together. We can do a digital consultation, get the diagnostics, the information we need, and then make sure that you as the pet owner and you as the medical team are all connected to sort of discuss those results. So incorporating virtual care doesn't just save us time, but it can also save us space, and then sort of in this coronavirus environment actually allow us the flexibility to continue to provide care. So remote consultations, right? Remote work was not something I think a lot of us are particularly familiar with, but the idea that we have this platform that allows us to do consultations from anywhere really gives us a huge amount of flexibility. I talked a lot pre-coronavirus about how it's a great option to help free up exam room space. Coming from practicing in an urban environment, space is at a premium. So if we had the ability to free up an exam room, it gives another opportunity for in-office care while another vet is doing a digital consultation. I think in the coronavirus world, the idea that you could have fewer people in your hospital, but yet offer remote consultations, right? Have the ability to do work from home. If you have a disparate team, people in different places, you're still all able to work together to offer consultations to your clients. Even in a non-coronavirus world, people always talk about how the ability to do appointments from anywhere can really improve the quality of life for your staff. And so maybe you have a really rough commute. So maybe in the morning you could do virtual consultations from home, come in a little bit later and miss really bad commuting times. Or maybe you have personal reasons, family reasons, health reasons why you're not able to spend as much time in the office as you'd like, but you'd still want to be part of, make that extra money, stay up to date with your clients. You have that opportunity to do so with digital care. There was a study done by Stanford University in 2015 talking about working from home and, how did it have real benefits? And this study actually talked about how doing something new at work could sort of help improve your focus and decrease burnout, and then actually make you more effective when you returned to the office. I think it's a really interesting study to think about now, when I know I would actually probably be really happy to be able to go back into work. But I think that flexibility of being able to offer consultations anywhere, it may be that digital becomes such a part of our life during this crazy time that people kind of get used to it, and maybe it's going to be more part of our lives afterwards. The very last thing I'm going to talk about for remote consultations is the ability to capture after hours revenue if you'd like, right? So if you wanted to be able to extend your hours or offer some, on call, you have that option. And because you're going to be able to charge for it, right, you have the ability to say, yes, I'm happy to talk to you after hours, but you're going to be able to pay for it. So all of this, gives you that great flexibility. Now, we've talked about how digital saves time, sort of allows flexibility. So now we're going to talk about how digital can sort of offer you these new revenue opportunities. Again, when I talk about this pre-coronavirus, I was pretty much sort of talking primarily about how, we hear a lot about how we're mainly losing money, and our concerns are pharmacy, right? Nationally, pharmacy sales make up about 1/3 of practice revenue. And historically, vet hospitals have dominated the pet medication market, and they continue to do so. Last year, this year, and are about 74% of total sales of medications are done in brick and mortar, mainly a lot of times because things like vaccines have to be done, but and online sales are only about 15% of pet medication sales, but expected to grow. I imagine that with, the coronavirus, we're seeing more and more of online. But we know that this is sort of an area of our business that even pre-coronavirus was something a lot of us were aware, and figuring out what the best way to do to sort of manage that was. And one of the things that I always think is kind of interesting is, as a GP, right, we're seeing sort of this explosion of specialty care recently to meet client demands for tertiary and specialty care, which is fantastic. But what it can mean is that some of those surgeries, some of that ER cases that GPs are managing are going more and more to referral and specialty care. So that might be something that as a general practitioner, you are losing a little bit. And then obviously now we definitely have to talk about coronavirus. A lot of our practices are only offering sick visits. We're not doing wellness. We're either reduced hours and different staff. I've been speaking to a lot of vet practices, and it sounds like a lot of practices are looking like they're about 20% down in revenue due to coronavirus. So the last place that I think we're losing money, which should sound pretty familiar to a lot of you, this is a screenshot here of my phone. This was something I got from a friend of a friend. And so it's these quick questions, right? These phone calls, these emails, these texts. I spent 25 minutes responding to this person and their new puppy. I made no money, right? So we're giving away, I figured out I was giving away more than $100,000 per year in sort of lost exam fees just based on the time I was spending. Right? So we can't necessarily control for things like where our pet owners are buying their medications. We certainly can't control what's happening with coronavirus, but what we can control is our time and our expertise. And so with some small changes, we can leverage our value and create new convenient revenue streams for the practice. So now I've talked about all kind of the bummer stuff. Let's kind of talk about the good news here. Right, so the veterinary market, we have 65% of US households have pets. So we have 80 million homes in the US with pets. The numbers of pets per family is increasing. So those that do get pets tend to have more than one pet. Pets are now becoming members of the family. More and more people are saying, yes, my pet is considered a family member, and getting them the care that kind of goes along with that. Spending on veterinary care is growing. It was $18.1 billion last year and predicted to be up 4.8%. Obviously, we don't know, maybe just in this coronavirus is going to change things a little bit, but people sort of are spending on their pets. There have been some reports that talk about how the number of visits is declining. So this is kind of also another opportunity to incorporate telemedicine to increase high quality touch points with your clients conveniently where they are. And this is because clients are willing to pay for this service, right? When you give them this sort of improved service, clients see a digital consultation as much closer to a house call rather than a phone call. And clients who spend on telemedicine are more likely to spend 25% more on your ancillary products and services. You know, we've found that across the country, clients are willing to pay almost in line for an in-office exam for a virtual consultation during regular business hours. And you can use these telemedicine appointments to drive your clients, you know, back to either your online pharmacy, your clinic, and sort of keep them within your practice ecosystem rather than losing them to the Chewies and the 1-800 PetMeds of the world. So, you know, so we talked about sort of short-term gains, but we can also, by implementing a telemedicine platform, you can set your practice up to continue to grow and thrive with future revenue. So our clients have already gone digital, and if they weren't digital before, they're definitely digital now. So millennials, I think not everybody likes to talk specifically about this group of people, of which I must include myself, but you know, they're the largest consumer of vet resources and the largest pet owning population, and 2/3 of the millennials say that they would switch providers if digital care wasn't offered. You know, this is a group of people who are spending $67 billion annually on their dogs and, you know, $34 billion on their cats. And so this is a big group of people who are willing to pay, and they're looking for digital. But what I also want to point out is it's not just millennials. When we talk, all consumers want access to convenient virtual care. All generations are used to this, right? We've used the Amazon and the Netflix and the Uber, and now, especially in coronavirus, right, things like Instacart and all of these on-demand services, people are kind of expecting, you know, they're used to digital. It's really becoming a part of their lives. So I think what can kind of drive some of this home for you is I'm going to talk about some real life case examples. So these are, so this is this first one here is a multi-location, multi-doctor small animal hospital in New York. And so the first month that they launched, they did about 150 paid consultations. They did some free as well, but they did 150 paid consultations and made about $28,000 in that first month. So this worked out to be about 6 consultations per day. So this is across all of their you know, staff is less than a consultation a day. You know, when we also have here an AHA practice in Michigan on the first month they launched, and they did a really interesting platform where they offered you know, support from their support staff as well as their vets as well. And so they did you know, over 200 consultations and made about $10,500. So it's a few more consultations, but again, they're leveraging all of their staff. And lastly, let's talk about sort of a single mobile mixed practitioner in South Carolina. So in the first 2 weeks for this client, they did 17 paid consultations and, you know, made over $1,000 with about just over 1 consultation a day. The key point here, right, is that these consultations were 9 minutes long. So this is, you know, money that this practitioner wasn't going to have previously. So this is sort of all extra that this veterinarian was able to get in less than about 10 minutes a day. So, you know, those are, I think, some really concrete examples of the benefits different types of practices have seen in the different ways that they're using it. So I also kind of want to talk about some of the cases that they've used there, just sort of to make it a little bit clearer here. Down on the bottom, we have sort of the common cases that we see that tend to be pretty successful in you know, digital consultations. This pie chart up here at the top is actually data that's come through our platform. So I think one of the big things I bring up here is we see a lot of dermatology. So, the rashes, the lumps, the bumps, and then internal medicine was sort of broken down into, wellness, those like, do I need to come in questions, things, like, urinary issues or anything like that. A lot of those kind of all got grouped in here, which is probably why the internal medicine category is the biggest. But then we have, our post-surgery rechecks, our triage, behavior. A lot of this is exactly sort of what we're seeing here in the platform ourselves. Now, when I show this to people, one of the questions I get sometimes now is people are like, okay, great. So what is going to stop my clients from saying, I'm going to do virtual care because it could be less expensive, and then I'm actually going to lose money because that person isn't going to now come in, they're only going to do a digital consultation. I get that it's shorter, but if they'd come in, I would have made more money. Well, virtual care can actually help drive those clients into your practice. So 38% of clients who complete a telehealth consultation schedule an in-office appointment within the next 3 months. And one of the ways you can really do is use your digital to drive those clients back in. So these sort of like post-digital exams, right? Like maybe I've done a digital consultation with you, and now I say, yep, I need to check in with you, in 1 month, 3 months, and sort of saying, to continue to be able to offer digital care, I need to make sure I see you once a year. You can use, digital as part of your toolkit of how you can get care to your clients. It's not a replacement for care. It's another way that you can continue to incorporate it and use that to drive clients back into your practice. Also, what we found is, we've talked about how successful a lot of these consultations are for your clients. And we know based on some studies, done by Vet Practice and DVM360, right? Happy clients are more likely to return. They're more likely to recommend you to others, and they're more likely to spend more per visit when they return. So not only do you have clients who've had this great experience, when they do come back, they're going to be spending more, and they're going to be telling others about you and driving more people into your practice, right? So you can use this, to make sure you're keeping your clients as happy as possible too, and again, in an easy, structured way for you. It's also a great way to differentiate yourself from other, the rest of the crowd, right? Clients are, if they're looking for a new vet, the first place they're going to do is they're going to look online, they're going to ask their friends, right? So if you have this service available, you're going to make yourself more appealing than those that don't. So I think we've talked a lot now about how the ways that this can help our practice, but one of the things that I really like about this is that it allows you to sort of extend care to those who may not have as much access to veterinary care. We could probably talk a lot, and I'm sure a lot of you know about these, shifting pet owner demographics, and sort of the integration of pets as family members more and more into families. So we know that this human-animal bond is sort of stronger than ever. So by implementing digital care in your practice, you have the opportunity to reduce some barriers and extend coverage to your clients. Right? So again, I imagine that a lot of this will look familiar to some of you, about these barriers to veterinary care. According to the AVCC, it's that almost 30% of families are experiencing barriers to veterinary care. And in that survey, they found that almost 23% of respondents had trouble getting preventative care for their pets. Right, and the two big things they talked about were sort of financial limitations and logistical barriers, and cost, being by far the number one reason that people are having trouble accessing veterinary care for their pets. So this is where implementing a digital care can really be helpful. One of the things is implementing sort of virtual incremental care plans or rechecks. So I think a lot of us talk about how when we talk with our clients, you sort of have a whole host of different plans. I sort of called it the do everything plan, and then you kind of scaled down from there until sort of you figured out what made sense for the clients, for your patients, and sort of what you medically felt comfortable with. So sometimes, there's the option to the do everything where it's going to be a lot of diagnostics, a lot of money right up front, and you're kind of going to go all in. That, for a lot of reasons, may not be available for people. And so if you have the ability to spread this out over shorter, more frequent digital visits, right? Say, okay, actually, we're going to try this, and then I'm going to check in with you at home. We're going to monitor. As a veterinarian, you can feel more comfortable because you're getting that feedback. You're checking in with them, so you're not just sort of giving them something and like hoping that it works and not necessarily always being able to follow up. Because we know that it's either expensive for your clients to keep coming back for in-office exams. It's difficult for them to get there if they don't have access to transportation. Maybe if they are working hourly, they don't always know, I can't necessarily make an appointment in 3 weeks because I don't know what my schedule is going to be in 3 weeks. And I don't want to take time off to come to the vet because then I'm not going to be earning. Right? There are a lot of reasons why getting to the vet itself can be very difficult. So if we can make it so that we can do shorter, more frequent visits and sort of incrementally work through a problem, it can really open care up to a lot of people who might at first not have thought that they would be able to access that care. Another way we can help out is sort of by helping triage some of these cases. Right? Sometimes people, because of concerns or inability to access veterinary care, either wait until and hope something's going to get better, and then they kind of wait, and it gets to a point now where it might be serious. So if maybe we can interact with them earlier and be able to sort of triage that for them, we can give them opportunities. And especially now in a coronavirus situation where we have a little bit more freedom with offering care to new clients, the ability to offer them some high quality care because we're able to assess them and get some more data than what we could get just over the phone, and say, yes, we definitely need to see you, versus, okay, here's some stuff we can try and let's check back in with you. And then sort of lastly, one of the ways that we can sort of help break down some of these barriers is, if it's a distance issue, right? It doesn't matter how close or how far you are on a digital call, right? If your state's one of these really, really big ones and you don't necessarily have a ton of veterinarians, it doesn't matter if you're 2 hours away from your client. Let's do that recheck. Like it doesn't matter. They don't need to come to you. Or if you're in an area that maybe doesn't have the specialty care that you need, you can use digital to connect either directly with a veterinarian specialist in another location, or include your client as well and have sort of the three of you all work together as a team digitally to help get the best quality advice to that client. So I think these are some ways, and once you start thinking about all the things that digital can do, you see that the options sort of, the more comfortable you get with it, the more options you see of the more ways that you'll be able to help by implementing digital care here. So now we're gonna switch gears a little bit and jump in and chat about coronavirus. So this is one of these things, sort of, I've been speaking with my friends a lot lately, and most of them are veterinarians, and we talk about how funny it is that stuff in the news doesn't often affect our everyday, right? Like you hear about things that are happening, but your day-to-day just kind of keeps going. But obviously this is something that has been affecting all of us, right? Like I have been inside for a month, can't complain. A lot of people have it a lot worse. My friends who are still practicing GPs are doing a lot of curbside work. One of my former intermates is a criticalist and packed up his ventilator and went off to the local Humane hospital. Right? Like lives are changing, practices are are closing. It's definitely a huge change. So I kind of wanted to briefly cover some of the updates and share some of the resources that I use to try and sort of stay up to date, and talk about some ways that we can position virtual care to your clients as a way to help them and help you during this really weird time. So I think, coronaviruses are not particularly new to us, right? This is not going to be a virology lecture. I am not a virologist or an epidemiologist, but again, gathered the information from all of those experts. So, right, like we as veterinarians see our different alpha, beta, delta, and gamma coronaviruses in our dogs, our cats, cattle and chickens and horse and pigs and turkeys, from FIP in cats, kennel cough in dogs, scours in cattle. Some we routinely vaccinate for, others not so much. Excuse me. Humans, only had 6 until recently, and obviously now we have, the SARS-CoV-19. So I think mainly our questions come in here when it comes to, right, COVID-19 and companion animals. So based on the research we have at the moment, according to the OIE, right, the coronavirus has a suggested animal source. Genetic sequence data reveals that COVID-19 virus is a close relative of other coronaviruses found circulating in horseshoe bat populations. I actually think that that's kind of adorable. Side note. Currently the spread of COVID-19 is the result of human-to-human transmission, right? So that community spread occurring mainly through respiratory droplets produced when an infected person coughs, just like other sort of respiratory pathogens, hence all of our mask conversations. Right, but there's no evidence at this time suggesting that companion animals play a significant role in spreading of the disease. So that's sort of where I think we have a lot of questions from people about is my pet going to get me sick? What's I think really interesting too is now that we have a little bit more data. I think we all heard about that first dog in Hong Kong who was positive, and then unfortunately passed away, but turned out just was an older pet with some pre-existing health concerns. I'm sure a lot of you probably heard about the 2 cats in New York. Right? So we're getting a lot of this more information, but on studies, it shows that dogs seem to be susceptible but not necessarily infected. Cats, so it's, again, according to the OIE, showed from laboratory studies that animals that have been tested, cats are the most susceptible so far, and cats can be affected with clinical disease. Also, they found, interestingly, that cats can spread cat to cat in a lab. They also tested ferrets, which were susceptible to infection, but less so to disease, but could transmit ferret to ferret. They tested Egyptian fruit bats, which were infected, but didn't show signs of disease and weren't able to transmit bat to bat. And interestingly, poultry and pigs do not seem susceptible to this virus at this time. So we have a little bit more information than when we started, but still not all of the information. And there's no evidence right now to suggest that animals infected by humans are playing a role in the spread of coronavirus. Human outbreaks are driven by that person-to-person contact. But I think what we're getting a lot of is questions from pet owners that are saying, well, if I'm sick, can I get my dog sick, my cat sick? If I'm sick and somebody else takes care of my pet, is there a potential that they could get sick? So these are the recommendations from the CDC, that if you're sick with coronavirus, ideally you want to limit your contact with your pets. If you can't, avoid petting, snuggling, kissing, sharing food, and follow appropriate hygiene. I believe this afternoon they also added please keep your cats indoors. Don't have your cats going out if you are sick. And if your pet, if you're walking your dog, please keep them on leash, and try and keep them 6 feet away from other people for security. I believe that was an update that happened this afternoon. Now, one of the other things that we've already gotten some questions about is things, that paper that came out about ivermectin. So obviously we're all very familiar with ivermectin, and some of our pet owners might notice, hey, that medication I've been giving my dog, can I take that to help protect me against coronavirus? Obviously, the FDA has come out, and I think you all agree, like, please do not take ivermectin products intended for animals. Not a great idea. So I think that goes without saying, but wanted to put it there. That's sort of the FDA statement. Now, one of the newest things that's kind of come out that might bring up a lot of questions with your clients, so I wanted to bring it up here, was the IDEXX PCR test. But what's interesting about this is you cannot just order this test for your clients if they're worried. You need to consult with your public health authority, so usually your state vet, and then fulfill these 3 requirements to be able to get that test. If you want some more information about that, you can go to the IDEXX website. I listed that here, and this is the picture from the IDEXX website. So again, your clients may see this in the news, it's been sort of all over, but this is not going to sort of be a free-for-all. This is kind of going to be done in this controlled fashion, but again, just some information so that you can help share with your clients. So this is kind of, I wanted to give that little bit of a background to kind of give you an idea of what your clients are seeing, right? What your clients might be thinking, and sort of in the scary world of isolation and social distancing. This is where our pet owners are making their personal health decisions and health decisions for their pets. So one of the things we know is that we're seeing a lot about the growth of telemedicine. Right? The CDC and the World Health Organization encourage the use of telemedicine apps to keep worried well out of the hospital, right? To help reduce the burden on hospitals working over capacity, as well as conserve those much needed PPE supplies. The Cleveland Clinic, for example, was suggesting that patients set up video visits with doctors who then decide who needs to come in and who doesn't. American Well is a company that does predominantly digital care. In December, they saw an 11% higher than normal volume. Plush, which is a US-based human telemedicine company. According to their chief medical officer, they've seen a 30% increase. And really interestingly, we have some data from China. So Ping Good Doctor is China's largest human virtual care platform. It's done on sort of like a membership basis. And so they've seen their numbers increase 9 times for number of visits since the start of coronavirus, and they've seen sort of sign-ups as part of their membership program be increased by 10 times again since the beginning of coronavirus. So, our clients are seeing telemedicine for themselves and are seeing this grow, and because we're now seeing our pets as part of our family, they're expecting it for themselves. They're going to start to expect it for their pets. So, what else does this mean for our clients, right? They may be disinclined or unable to go out or congregate or take public transportation to get to you. Maybe they're taking care of elderly family members. Maybe their kids are home from school, and the idea of having to pack everybody up and go to the vet, is not necessarily something that they're looking for. A lot of our vet practices are doing only emergencies, right? So they may not even be able to have that option to go and see you. We also know everybody's sitting at home, and so they are staring at their pets, and now they're seeing all those things that they didn't know that they do, and so now they're worrying about them. I was talking with one of our partner hospitals earlier in the week, and they were saying, yeah, I'm answering a lot more questions about anal glands because people aren't realizing that their dogs just sort of sit at home and sometimes are just licking their bum, and that's totally normal, right? These things that clients are now spending a lot more time in direct contact with their pets and are now worrying more about their pets, so have a lot more questions. So are going to be looking to somebody to answer some of these questions for them. One of the other things is, right, they may have this more time to worry about them, but they also may not necessarily have a huge amount of money now to spend on their pet. I mean, if you think about sort of like an hourly worker, 3 days off work with no pay could be a month of groceries or a utility payment. Like, the idea that we need to go and see the vet can be kind of a daunting task for some people at this time. So this is where a digital care platform can be really invaluable, and having a video-based platform will allow clients to get access to high quality care sort of safely from home. Right? You don't need to leave, you're able to get high quality care. It's funny that we, pre-coronavirus, would often talk about how we would use telemedicine to drive clients back into the practice. But sort of in this case, we are using digital care to keep just like in the CDC and World Health Organization examples, keep those that don't need to come in sort of at home and offer them some of that care. The highest risk group for coronavirus is probably the generation we wouldn't all immediately think about using digital care, but actually having an easy to use platform, making it possible for them to connect with you as well. And I think, one of the big things is, right, we want to make sure that this is the best option for our patients. So, it can help our clients by, rather than worrying and Googling, they can actually get actionable information from you, rather than putting off their concerns and about a pet and having it get worse and therefore probably more expensive. You can give them this option, that can be a little bit more economical sooner. And offer, again, this high quality advice. So it's pretty easy to see why clients would be on board with this, but how does this sort of help your clinic, right? How does this help those of us struggling on the practice side, right? So a couple ways. So the first is, right, by building trust with your clients during this time, they're going to be more likely to return to you again and again. So McKinsey came out with an interesting sort of paper at the beginning of all of this, talking about what businesses could expect coming through coronavirus. And one of the things that they talked about is companies that navigate disruptions best often succeed because they invest sort of in their core customers and sort of anticipate behaviors, right? So you can say, we know you're worried. We know you're going to be looking to reach out to us. We're here for you. And this is our plan, this is our solution, and this is how we're going to help you all out. As I talked about, right, you may have an increase in client questions. So by using a structure, it's going to structured platform. It helps you manage that increased client demand. You can flex up and sort of leverage all your team members, even if you're in a distributed team, right? You can have your CSRs help you. You can have your LVTs help you. You can have your vets. Everybody can be in different places, but because of cross-team communications, you're able to sort of still keep everything centralized, integrate into your practice management system. So again, it doesn't matter if you're not in the practice, things aren't going to get lost, and you can sort of easily manage all of your appointments, even if you're a little bit busy and maybe not even in the building. So it also gives you this revenue opportunity. I think we talked before about how we're losing revenue because of coronavirus. But this opportunity, you can charge per consultation and help offset some of the loss to that in-office revenue. In regular non-coronavirus circumstances, I often talk to people about how usually 20% of what you do during the day could probably be done digitally. And then if you can convert just 1 or 2 of those things to a digital consultation in less than 15 minutes a day, you can be making about $500 more a week. Right? And so with this increased demand from isolated families, it's going to be pretty easy to do a lot more than 1 to 2 consultations per day. It's also going to sort of help set you up for continued revenue post-outbreak. It might be difficult for some of us to think about. We don't really know what life's going to look like afterwards, but one of the things that a lot of reports are talking about is how customers changing preferences are not likely to go back to pre-outbreak norms. So if we can set up a system that's structured for you and helps you, continue to get some additional revenue, and your clients are now used to digital, and this is so much more a part of our lives, why would we go back, right? We can continue to still use the benefits, right? We developed our platform based out of my struggles as an associate vet pre-coronavirus. It's still going to solve those same problems after coronavirus hopefully goes away and we can all return to normal work. And as I mentioned, the ability to have remote work, you can continue to work from home and sort of blunt that drop in productivity, with these recheck exams, with follow-up exams, with, patients with standalone concerns. It still gives your employees an opportunity to still continue to earn, even if they're homebound, which may be hugely helpful to them. So, all right, sorry, 1 second. Sorry about that. Tickled. Now, great, right? This seems, we've talked about all of these really amazing options. Let's say I want to get started. How does that even happen? And I think this is sometimes a little intimidating, but really doesn't need to be. Step 1, let's be proactive, right? Show your clients that you're prepared. You've acknowledged there's an issue and you have a solution for them. We know that this is scary and stressful, but we're still here for you, and here's how. When you pick a platform, you want to make sure you pick a partner, right? There are lots of, there are a few companies out there and everybody does things a little bit differently. Make sure that you're picking one that works for you and helps you achieve your goals. So you want to make sure that it can be easily integrated into the way that you practice, right? Enough is changing. We don't need to change more than we have to. And the more familiar it feels to you, the easier it is going to be to get going. Make sure that there's the support and the training, for you and for all of your staff, because you want to make sure you have all of your staff on board, right? Veterinary medicine is a team sport. It's going to work best when everybody's involved. Having everybody from your CSR team to your vets and your techs, you have that flexibility to have everybody on there. You don't need to, but generally I think just, it all works best when we work together. And some of these things, like these incentives, are things that we talked a lot about in a pre-coronavirus world. When we're trying to change stuff, it takes about 21 days to form a habit. Right? So if we can come up with an incentive that gets people excited about something for a couple weeks, then that's going to really become a habit and become part of our new workflow. I think for some of us, we had to change our workflows a little faster than we expected, and so this is a little bit less of an issue, but definitely getting everybody involved and feeling like this is all part of a team. And then lastly, right, you got to let your clients know, and it's how you position it to your clients that's super important, right? So you're not using digital care as a replacement or a way you just want to charge them. You're using digital care because it's you're offering your clients this great new service, this high quality connection that's solving these issues for you, right? You're able, rather than just having a phone call, you're able to have a high quality digital consultation. You're making it easier for them to stay in touch with you. So positioning it as this new service, a new tool, as a whole host of the ways that you work with your clients is really going to help them see the value. You want to sell them on the benefits, not on just the system. And obviously then let them know what you're going to use it for, set those expectations that this isn't for everything, it's for what you feel comfortable, and so that they kind of know what they're getting themselves into, and then you can start small and expand sort of as you grow. Or I think a lot of what we're seeing now is people are kind of jumping in head first, like some of those case examples I gave within the first month. You're really sort of hitting the ground running. So as I mentioned at the beginning, I am not a virologist or an epidemiologist. All of this specific information about how coronavirus affects patients in particular is taken from all of these great organizations that are doing all the research, right? So these are great places that I use to stay up to date with what the changes are and what's happening. I also wanted to mention that there are a few great resources specifically designed to help you speak to your clients and are more client-facing. Right? So the Humane Society has the resources as well, which are great client-facing resources. We also have a downloadable ebook that can be really helpful for your support team of great ways to talk to your clients about digital care and coronavirus, and how you're using it and why you're using it. So that's all accessible there. And remember, you're all going to be getting this presentation afterwards, so all of these links will be included there. Now that we've spent all of this time talking about digital care, I wanted to sort of summarize everything that we've learned, because I kind of throw a lot at you pretty quickly. So telemedicine, confines of the VCPR, dictated by individual state practiced acts, right? So a lot of states have put through some regulations that may have loosened the VCPR. If you're California, please stay on top of things. Things may kind of move the other way. And this is changing rapidly. Using a video-based telehealth platform can help you with your workflows and efficiency, help you generate some additional revenue, or help you make up some lost revenue during Corona, and help reduce some barriers to veterinary care for those who may have some difficulties. And lastly, so Corona is definitely altering our client behavior. And so implementing a telehealth system can help you adapt to these changes and sort of set you up for success in the future. Now, let's think, now that you've heard everything on this webinar, have any of you changed your minds? How likely are you to implement telemedicine in your practice now? I'd love to see, what people are thinking about now. I think for me, it's really important that we as veterinarians, want to make sure we're guiding this and not sort of getting pulled along sort of in the wake of here. So I'd love to see everybody vote, see where people's thoughts and changes are. I hope, we can see that this is a technology that can be helpful to us and to our clients. So I think we'll wait a little bit longer, let everybody have a chance to think it over and give us a vote. All right, so great. So it looks like people are definitely more likely. We've got some good definitely's. It's more likely. Great. I think it's a great that it's an opportunity to think of new ways that we can help both ourselves and our clients. So I think that's the really interesting there, and then kind of the end of. These are just sort of my resources. Again, you'll have all of this, but I kind of wanted to open it up to you now. I believe we're going to have some questions. You entered them all as it went along, and we'll see how many of them we can answer for you, and kind of go from there.
This was terrific, Dr. Jones. Thank you so much.
Well, thank you so much for having me.
Yeah, really wonderful, wonderful information. We have a lot of questions, so this is great that we have some time to answer them because I think people are really curious. We have several questions that I would say go into the category of specifics about platforms. So our audience knows that you are from Telltales, but to avoid conflict of interest, she's not recommending necessarily her platform. But what we do want you to tell us maybe is a little bit more specifics about what people should be looking for in a platform, and really importantly, because the question's been asked multiple times, how do they collect fees?
Absolutely, yes. So I would say different different platforms do things a little differently. Obviously, I know about one really well, and I know about the others a little bit less well. But when it comes to fees, I'm going to answer the questions two ways, right? There's the I'm presuming you're saying from clients to you as the veterinarian, and
yes,
then,
how do people pay? Yep.
yeah. So in most systems, when clients create their account, they have to enter a credit card, right? So that you know that you are going to get paid, whether it's you put an estimate in at the beginning and your client needs to agree, or you have a set charge, clients know ahead of time. That's sort of most of the time, then all the payment is done through whatever telemedicine system that you choose. So you don't actually need to worry about the payment element, because you just say, I'm charging this amount. And so, for example, some platforms, it's a flat rate, right? And it's going to be this amount. Others, it's customizable per interaction. So if that's something that's important to you, right, figuring out different, different platforms do things a little differently. So do you want to be able to say, well, for some consultations, I want to charge, $85, and for other consultations, I want to charge $20. Do I want that flexibility versus, okay, I'm charging, $55 for all of my consultations? And that's absolutely something every platform would be able to talk to you about, but most of them, that's very easily set up. Because I think that for me was sort of a really big issue, right? If you're talking over the phone, technically, yeah, I guess you could talk to somebody and say, well, I'm now going to send you a bill, but that's awkward and nobody's really going to pay that. So having it all easily integrated into the system that they're using means it's going to, you don't have to worry about having that awkward conversation, and you're going to get paid for your time.
Okay, and interesting because a couple of people have asked the same question about how do you suggest weaning clients off of the idea that I just have a quick question, and we all know this, anybody who's in private practice knows this, we give away so much free advice. And so we have a few people asking you, do you have any suggestions how we wean people off of that? And not to say, because other people are asking, does that mean you charge every time you speak to someone?
So what's great about most telehealth systems is that flexibility, right? So if you want to not charge, right? Like if I have somebody who comes in and I do blood work and I'm calling them with the results, I'm not charging them for that, right? Like we talked about the blood work, that's sort of part of what I did as part of the exam. But if I have somebody who calls me with a very specific question and I'm going to spend 25 minutes talking to them, I should be paid for that time. And so this question is something we get a lot, right? Like, yeah, how do I get people who have been getting something for free to now pay me for my time? But I think it all comes down to, you're getting so much more when you do a digital consultation than when you do a phone call, that you're not saying this is a replacement for a phone call. This is a new service. Like I'm positioning this as, hey, even you can help with your CSR teams, right? If somebody calls and was like, oh, is Dr. Jones available? I have a quick question. when they kind of say what they're calling about, even having your team be like, this actually sounds really perfect for a digital consultation. The doctor will be able to get more information about what's going on and give you, some much better answers, and sort of position it as this new service. And clients are actually really excited about it. Because then actually they get to be sort of part of the medical team. One of the things I found most interesting of talking to the pet owners who've used it is how excited they get when the vet's like, oh, can you lift up the lip for me? Or can you make them walk back and forth? The clients now feel like, oh, I'm part of the team. I'm helping my vet get answers. And so they see this as a lot more of a new experience. And so are actually very willing to pay.
Okay. And do you charge sometimes, is it a unit of time, or that's just flexibility that you can work out with whoever your platform is?
Yeah, so that I think is sort of a platform thing. Like some people it's a specific amount of time, other people it's a customizable amount. Some, it's, and that's how do you want that? So I can let you know, right? Like the average video consultation is 7 to 8 minutes. So a lot of times we talk about things in 10-minute increments because that's what makes the most sense for the for most of our use cases.
Mm-hmm. Okay, so then there's a whole other group of questions here that are the ones I'm sure most of us have. So we are trained to do complete physical exams. Mm-hmm. We're trained not to focus in or zoom in, as Christine says, no pun intended, on the ear infection or on the other thing. So as far as how do we talk about the fact that we're not doing complete physical exams, that if an animal has an ear infection, we're not able to look down and see whether the eardrum is intact. We missed the heart murmur, we might miss an abdominal mass, that kind of thing. So there are a lot of those kind of questions. So if you could speak to that, that would be great.
Yeah, absolutely. So I think that the way to think about this is an additional tool, right? This isn't a replacement. These are the clients that you've seen, right? So you are now offering digital as an additional element. So if you if you do a digital consultation for an ear and things aren't improving, right, you're going to have them come in. You're still going to be seeing them in the practice, so you're still going to be doing those hands-on physical exams, and you might actually have a chance to do them a little bit more because if you're using digital to drive clients back in, right? So this doesn't replace an annual exam. This doesn't replace an in-office exam. It's just part of an additional tool, all right? So when you're having these conversations, it may even be where you're like, yes, I need to see you in the practice for this thing. So right now we're going to deal with, we're going to deal with your superficial pyoderma, but what I need to do then is in 2 weeks we're going to see you in office, or we're going to do, you are going to integrate it in the way that you offer care so that it's not sort of one or the other. It's both mixed nicely together so that you are getting, right, those hands-on physical exams so that you can catch the stuff that clients don't know that they are supposed to be looking for.
Right, and I think that's really important. I can tell by some of these questions that are coming in is it isn't going to work perfectly for every situation, and that we as clinicians with our experience, we know when to tell someone to come in, or we should feel confident enough to say to someone, you should come in, So I think you just really have to use your professional judgment, and no one is suggesting to you that you don't absolutely need to see these people. You can do everything through telemedicine. The other question is, if you do a telemedicine consult and then you ask them to come in because you need to see them, are you charging for both of those?
Yeah, great question. And this is something that I spend a lot of time chatting with different hospitals about is that, yes, so I do recommend charging for both, but it's the price that you charge, right? So you don't want to discount your video consultation, right? It'd be like, oh, you're coming in, so now you're not paying for this. You'll pay when you get in there, right? Because you don't want to discount the time and the expertise that you offered in that digital consultation. But yes, you have already spoken to them, like you know what you're doing. You're kind of getting started. So a lot of times we talk to practices about having sort of a discounted, like, post-digital recheck exam. So it's they're getting a discount on, like, maybe a discount on what your like recheck exam fee is, something. So they are definitely seeing some value in not having to pay 2 full exam fees, but they, it is your time that they spent, and now you're going to be offering additional care and services. So some people do it, if the digital consultation was like, I'll do numbers that these are not numbers people are using. I'm just doing it to make the math easy so that I can do mental math at 9:30 at night. So it's like, say your in-office exam fee is $75, and so you offered a $50 digital consultation. So maybe then you're going to charge like 45 for when they come in or something, right? So they're still getting a discount, but they are paying for your time. Does that make sense?
Yes. Yeah, and again, I think people, you're not going to be prescriptive to people. You're giving them an idea, and it may be that they're going to charge X amount of dollars for a 10-minute consultation. Someone else may charge Y amount. So this is just general information. I do think that if you could help us to get an idea of how should people evaluate some of these different platforms. You talked a little bit about being integrated with your medical records. Could you be a little more specific about that?
Yeah, absolutely. So, I think one of the things is, having the ability to, the information that you have expressed, either directly in your medical records, or having the ability to enter medical notes and have that sort of integrated into your practice management system, so you're not then rewriting up notes, right? You don't have to. I think one of the things I found most frustrating is if you're on call, right, then you have a phone call, then the next morning when you go back into the practice, you have to remember what happened and write up a client communication, right? So if you have the ability to enter notes and have things sort of archived so that you can sort of have that seamlessly integrate into your practice management system, can be really helpful in terms of both liability and time saver for you. Mm-hmm. I think it's, right, do you want it to be a tool that you're using to offer care to your existing clients? Do you want it to be outsourced, that somebody else is offering the care and you're kind of just letting, okay, I'm letting somebody else handle this? Do you want it to be video based? Do you want it so it's sort of like live video based? Would you rather it be something like messaging only? Do you want it to be within the VCPR or outside? I think those are sort of the things, sort of thinking about, like, what problem are you trying to solve, right? For me, it was very much, I want to connect with my existing clients to offer them high quality video, right? So that's sort of where we focused, versus some people who may say, okay, we're doing, more of an outsource model, or we're doing more of a concierge care model, and finding the platform that whose focus is, the problem you're looking to solve.
Mm-hmm. Okay. All right, so one more group of questions that people have been talking about. There's some frustration that it seems like the veterinary profession is putting up a lot of barriers, and always has, for veterinarians being able to practice telemedicine, as opposed to the way in human medicine that doesn't seem to be the case. And so people are just wondering whether you have a sense of what the future might be. So if you have a crystal ball.
Man, a crystal ball would be great right about now. So, I mean, I think when I have this conversation with my colleagues who are not veterinarians, it is interesting that I agree that, I think we are a conservative group of people, right? We're, you know, the way we are trained problem solvers, but I think also not necessarily always the first to jump at something new, which I think has its benefits, right? If you medically, you want to make sure things are working 100% before you're the first person who jumps into something. So not that that's bad, but I do think that by being as conservative, we are somewhat limiting ourselves to all of the ways that we can be helpful. But I think that we're already seeing this kind of change even before coronavirus came and you know, brought some significant changes to the way that we're practicing. We did see more and more states and state organizations get interested in, okay, you know, how do we want veterinary medicine to work? How do we want veterinary telemedicine to work? You know, do we want to make changes to our State Practice Act that either solidify the rules that we want or make it easier for clients? And I think that maybe if one of the very few positive things that might come out of coronavirus is that it's giving a lot of people who maybe were a little bit more hesitant to try something new, sort of the push to try this, and we actually see the benefits that come out of it, and it might push us all forward to see, hey, we can all use this together. And I think that you know, we will see the change of telemedicine becoming more and more a part of what's happening. A lot of vet schools are talking more about it, and you know, in their curricula, and mentioning it, you know, to the vet students now, or who are going to be the future of the profession. Right, this is something that's coming. I think it's just how quickly it's coming, and I think that's why, for me, it's really important that it's great that we have organizations that are like the HSVMA and like state organizations that are supportive of telemedicine, but are making sure that we're driving this forward safely and appropriately, right? And I think we're going to get there. I just wish my magic ball would tell me when.
Well, listen, we're going to have to wrap up. This was really wonderful. Thank you so much for this information. I'm sorry to those of you whose questions were not able to be answered, but you do have Hillary's contact information in the PDF that we're going to send to you. So you will be able to contact her. So let me just wrap up here quickly. Thank you so much again, Hillary. This was wonderful. I just want to tell you guys, usually we have our CE credits by now, but since this was a webinar we put together pretty quickly, and again, I want to thank Dr. Jones for that. We did this very quickly, and the webinar team from HSVMA. We will, I'm sure, get this race approved. So if you complete the survey that comes in the email that's going to come to you in 24 hours, when we get our race approval, you, everyone who's eligible will get that for free. So please fill out that survey when you get the email from us. And those of you who are listening to this archived, remember that you have to take a quiz. You will not get a survey, and that quiz is on the below your screen that you're looking at right now. If not those of you who are here live, you don't need to take a quiz, so don't worry about it. And I want to remind you that the next webinar in our CE series is decreasing stress at the vet hospital starts at home. And this is with the board certified behaviorist, Dr. Meredith Stapita, and she's going to be with us on Wednesday, June 3rd. So we hope that you guys will join us in June. And in the meantime, while you're home, if you're home, although I think most of you are not home, we do have our archived webinars. We have over 30 CE topics to choose from, and you can find anything that suits your fancy. So thanks, everybody. Please stay safe. And it'll be interesting to see what state we're in when we meet again in June. Good night, everyone. Thank you for being here.
Thank you so much for having me.
Thank you.